We call this part secrets of efficiency, meaning there are certain practical advices, recommendations on how make your therapeutic procedure the most efficient. Of course, you already heard all that, but repetition is the mother of learning, so always remember that your therapy and your procedure is a teamwork, and you form a healing triangle, and you're going with the client through the healing process all the way, just basically holding your client's hand. You will be working on a principle here and now only. There is no diagnosis in your procedure, and your diagnosis, well, if you have a diagnosis for your client, it is a guidelines for you, something to keep in mind, but not to be preoccupied with, because diagnosis may be wrong, or it's just a name. That's all it is. Really, only client's own system knows what actually is going on. So you will be working on client's complaints, not on client's diagnosis. And for example, if client comes to you and says, I have stomach ulcer and I want that matter to be resolved. I have several other issues, but my main complaint is my stomach ulcer. And you ask your client, okay, close your eyes, concentrate on what bothers you the most at this moment. And he says, well, my stomach ache is about 3, my headache is about 7, and my, let's say, my tailbone itches about 9. What are we going to do? Tailbone. And the client, of course, will say, what the heck, why are you doing the tailbone? I came to you with a stomach ulcer. Why are you doing my tailbone? Well, here comes your skill to explain to him why we should start from a tailbone when... And Jeannie, I'm sorry, honey, you're interfering. So, you start with the biggest complaint, no matter what happens, because even in client's mind, his main thing is ulcer, and maybe it is. But here and now, his body is working on the tailbone, somewhere in the tailbone area. You want to go with the body, and eventually body will bring you to stomach, of course, because the problem is there. So just follow the body's dynamics. So remember that. And if we do not have diagnosis and we have problems that are undiagnosed, does it stop us from treating the client? Not in the least, because we will be working on complaints, whatever they are. If they are concrete complaints, we work locally. If there are no concrete complaints, general areas of regulation. Here and now, your treatment today will be different from your treatment tomorrow, or even about in an hour. So you will be working on a physical, mental, emotional, and spiritual level altogether. Now, indications for your treatments, for the application of the fusion. Well, pretty much any dysfunction that can possibly be imagined. There are no limits to natural healing. Therefore, there are no limits to what and how we can use our equipment on. Contraindications. Virtually none, because there are no contraindications to natural healing. But there are certain situations where you have to be careful. For example, when your client is not in control of himself. And that may include high fever, intoxication, if your client's under drugs or under alcohol, or if your client is mentally ill and there is no control over his own actions. Why is that relative contraindication? Why you have to be careful? Ideas?
You're not getting true feedback.
Yeah. Well, first of all, you are not getting a feedback. This is the least of all evils, because even if you don't get a feedback, you still can detect something on the body, like we work with animals. We are not getting a feedback from them. They cannot lead us. But we still work with them because we kind of know where the problem is, and our devices will tell you more. So that can be overcome. But there is another danger. If you, for example, working with a scanner, you need to touch the body. You don't know how your client will respond if they are not in control of themselves. Scanner is a little bit, stimulating, and so little electrical impulses. So, well, he can be violent, so you just protect yourself. So that's the situation. Another situation to consider is that you're running in something that you don't really know what it is. If a client has a fever for 5 days and you don't know the origin, you can run in some toxicity, you know it's toxicity, but you don't know the origin. Because what may happen is that after a while your client will need to go for conventional medical treatments, especially if it's something serious. And if it's something like SARS or AIDS, you will run into conflict with the mainstream medicine that you don't want to do that. So when you are not quite sure you are comfortable with treating a client, so you just stay away from it. There are no negative side effects to our treatments, because no negative side effects in natural healing. But it may be a situation when your client will run into healing crisis. If you, especially in the beginning of treatment of a chronic disorder, overuse the energy and gives too much, the system starts screaming, "Oh yeah, sure, I have energy now, I can heal," and throw you into healing crisis, which is good in the long run, but quite unpleasant for a client. So in order to avoid that, you kind of should keep in mind that when you're dealing with chronic disorders, especially if they're autoimmune, immune system is tend to give inadequate reaction. So like rheumatoid arthritis, for example, be careful. Better be on the safe side and shorten your treatments to maybe 20-30 minutes, but not doing too much. Because if you're giving too much energy to the system, the immune system says, "Oh, sure, here we go. All joints will swell, high fever, and off we go." So it can be a healing crisis. Just keep that in mind. You cannot do any harm with any of this equipment. So please don't be afraid to apply it, even if you don't remember the techniques, if you don't remember areas of regulation. Just do what you feel is right. We did intuition exercise. So just do what in your heart you feel is right for a client. And you will find yourself will be always helpful, even if you don't remember the little technical tips and tricks. So just do it. Now, where and when? Because we're working together with the body is giving us signs. So the worst part for a client, the time when complaints flare the most, the complaints are the most intensive and strongest. It means the body is working on it. Good for us. The stronger is the pain, the better for us. Then we will go right there. We know where to go. We will help the body. The body will resolve problem really soon. Actually, it is better for us to have pain on the level of 9 than nagging pain on the level of 2. The nagging pain on the level of 2 is really difficult to resolve because the body is not there. Like the body's attention is not at that problem. It's somewhere else. So we need to reconvince the body to start paying attention to that nagging chronic pain and then resolve it. If we have pain number 9, it's already there. All we can do is just help a little bit and the issue will be resolved. So the worst for client, the worse the client's condition, the better for us, the more effective and faster your treatments will be. So just remember that. If your client feels bad all the time and you need to choose the time, there are certain charts where internal organs functions at their full capacity. Like there is a time for liver to function at its finest, for lungs, for heart. So those charts can be easily found. Just Google it. and it's called charts of functional activity of organs. So when it's better, of course, to hit the organ at its peak of its activity, unless it's during nighttime. Then you, of course, will not do that. Now, how long? It's very individual. And your procedure may vary from a few seconds. For example, with a scanner, you can do a bee sting on a spastic muscle and relax a spastic muscle. You can jump-start a heart just by 2 seconds. With a laser, you can use just 30 seconds on the eye, and that's enough for the procedure. So it can be just a few seconds, or it can be as long as several hours, and you're treating something acute like stroke or frostbite. Your treatment may continue with specialists or practitioners changing each other. Like if you're treating a fresh stroke, we had a situation with a child, 3-year-old child who had a stroke as a result of a viral infection. And parents took turns. Parents and aunts and uncles, they just took turn and they did 24 hours. 7 days after that, child was completely back to normal. And that was a large, big stroke. So first of all, it's a child. So lots of stem cells, great regenerative powers, coherent body. It's an acute process. Treatment started right after it happened. And just took 7 days, but it was clock round work, basically. So it can be clock round work. Average, we assign about 30-40 minutes. In general, we say devices should not be in contact with the body for more than 45 minutes. It's enough for the body to do a good job, but it's not too overwhelming. So on your average, you would say between 30 and 45 minutes, your procedure. In our clinic, we typically assign an hour per treatment, but that includes also time when we talk to a client and time when we get the feedback and make client do something. We don't count it in the treatment time. So direct contact of the devices with the body between 30 and 45 minutes. If you manage to remove everything in 10 minutes, good for you, great, no problem. We still charge. We still charge per session. Just remember that. We don't charge per hour, we charge per session. And sometimes you do 10 minutes, remove everything, but then there are general areas of regulation always, right? Then you can do your 3 pathways, 6 points, which is always good. We can wrap a client in a blanket. You can charge chakras for 21 minutes. So there are always ways. Now, so that's how long we would be treating. Now, how often? By the way, how long you also will consider when you're dealing with a laser. There are how many joules of energy you actually gave your client. So there is a recommendation not to exceed certain amount. With Q1000, typically you don't have to worry about it because it's not that many joules you will get even in 20 minutes. But when you're working with stimulating laser like a 660 or 808, then you have to watch time and not over exceed a certain limit. It's basically almost like one cycle on 808, typically enough for to get a good result and not overwhelm the body. But there are also charts for the lasers to keep it under a certain limit. The blanket you can use as often as you want. There is no limit to the blanket. You can use as long as you want also. In the beginning, we try to keep the time of the procedure under 40 minutes, just for the body to get used to it. After that, you can live in it. Scanner and laser procedures, we will consider what type of situation we are dealing with. If we are dealing with acute process, just remember our adaptive reaction cycle. Adaptive reaction with acute process is going anyway. It's going pretty fast. The body is healing, and it may heal completely. Your job is just to speed it up as much as you can and get it over with in the shortest time possible. Which means that more often you will treat, the better. The more you will treat, the better. You will not overwhelm the body. The body is already in crisis, so all you can do is just help the body. So there is no limit to how often or how long your procedures should be. Use the laser as much as you can. Traumas, injuries, acute inflammations. Your scanner, we usually suggest at least every 2 hour or hour and a half, or as symptoms come back. You get the pain relief, it lasts about an hour, then pain comes back, do another 10-15 minutes. So the more often you treat, the better. Especially in a situation as flu or cold. If you have a flu, developing a flu symptoms, do it every hour, maybe just for 10 minutes. But then you can turn the entire flu in a day or two. That's all. Live in a blanket that day. Get your scanner to the places of the most complaints, of course. If it's a throat on throat, sinuses on sinuses. If you have fever, general areas of regulation always a good idea. Neck and shoulders, 3 pathways. Our little points, right? Especially thymus and C7, because immune system needs to be modulated in this situation. Tailbone, third eye. Just do it over. Designate a day for yourself. And do it over a period of a day, and you can be just good as new next day. That's acute. With chronic, it's a little different. Chronic diseases and disorders are big rusty wheels. They are slow. It's a process that cannot be moved. It cannot, that's why it's chronic, because the body can't finish it. Approach it as a big rusty wheel. That means if you give a wheel a good push, it will move a little bit. But if then you will stay back or stand back and watch, what's going to happen? The wheel is going to go back. Because in order for the wheel to keep spinning, you need to keep pushing it, right? A little bit. You can't really push it all the way right away because it's rusty. It's not going to let you do it. So what you are going to do, in the beginning of treatment of a chronic process, your procedures should be pretty often. Like 3 times a week, let's say. Can you do it every day? Yes, you can. But be careful not to throw a system into healing crisis. So it's not too much. So we recommend in general, when you start treating chronic processes, if they are in what we call a cold period, like when there is no acute relapse of the disorder, our general recommendation is to do treatments 3 times a week for the first 2 weeks. So 3 times a week for the first 2 weeks. Then 2 times a week for the next 3 weeks. You are slowing down because now the wheel is already spinning a little bit. Then you do it just once a week, because at this point in time the wheel is already spinning. All you need to do is just to correct it a little bit. How long that will last, we don't know, depending on the process. But in my estimation, basically 5-6 weeks, once a week. And then you can do just once in 2 weeks or once a month just on maintenance. So that would be a general treatment for the chronic process. Depending on the process, it's just a general recommendation. It's not a rule. You can deviate from it and do it every day. But my suggestion is, if you really want to get to the good dynamics, not less than 3 times in the first week. Because if you do it only twice or once, the body will do something and then it will just go back. And next time you just have to push it again and it will go back again. So once a week for chronic diseases, you're wasting your time. Twice a week maybe, but unlikely. So my suggestion is not less than 3 times a week. Every day would be better, but not too long. maybe 15-20 minutes. Okay, got that, guys? Good. In typically good treatment of a chronic disorder is between 10, 15, 20 sessions, something like that. After that, you can leave the body to do the job, because now the body is reprogrammed, the wheel is spinning, it will continue spinning for the next 2-3 months. Meaning, for the next 2-3 months, you will still see the improvements, even though you are not doing anything. And you may keep maintenance. Once a month, maybe just watch, do one or two procedures. We in our clinic we had lots of clients on maintenance who would come just once a month, just for us to make sure everything's okay. And we would do little correction, typically 3 pathways, just to make sure everything is fine, everything is in alignment. We do our energy assessment, we do 3 pathways, everything is okay, you're on your way. And we dealt with lots of bad chronic problems that way. That we already know. Places to work, right? Point of pain, symmetrical parts, corresponding vertebra, spinal segments, the corresponding vertebrae. What I didn't mention to you, another good area to work on, if you don't get good dynamics from your point of pain technique, it's to work on the entire segment of your corresponding vertebra up to the middle line, just like this. Call it dermatome. And utilizing channels and meridians of energy flow, it's always a good idea if you know where they are. Always work also on secondary signs. We already mentioned that. If something appears on the skin during your procedures, between your procedures, but during the course of treatment, always work on that thing, whatever it is. If it's an itchy spot, if it's a red spot, if something appeared on the skin, anywhere, work on it. It's there for a reason. Main attention you will be paying to your main complaint, regardless. So when you select your main complaint on the procedure, that's your indicator. That's what you have to watch for. Things to keep in mind when you are watching the dynamics of the process, healing process. The function always goes first. The body will be restoring function first and then restoring structure. Remember our boy with the osteomyelitis of the shoulder? Functioned much earlier than the supporting structure. So function will always improve first, and your lab tests and your x-rays will follow in about a month or 2. But the body is concerned about the functions, so function will improve first. During your treatments, you will always get the effect of 4 Gs. Good mood, good sleep, good appetite, good energy. That's always. And that is a consequences of improvement in your general adaptive reactions. Because improvement in adaptivity always give you effect of 4 Gs. Healing crisis is, you will, in the case of acute disorders, you will not have any healing crises. It's only if you have chronic situation and you gave too much energy. You will always observe healing going according to Herring's laws of healing. Remember, the disease is going from inside out, from the top to the bottom, from the more important organs to the less important organs, and back in time, meaning the more recent processes will be resolved first, and then the body starts bringing up the earlier processes. So these rules are still in place. That's how the body heals, and you will see that, bless you, and all the time. So when your client will start coming you with childhood diseases, it's a good sign. It means that the rest of the cysts are resolved. So cysts are breaking one by one, and the most recent will break first. You are reprogramming the body for rejuvenation and restoration of health. So it's difficult to measure because you are creating a maintenance program. Well-aligned body does not get sick. So it's difficult to monitor because we don't know really how to assess that. Typically, if you did your job right, the person just doesn't get sick because their immune system is well aligned, their natural healing system is strong, adaptive reactions are fast, so they processes everything fast, so they just don't get sick. And we don't know what would happen otherwise. So it's unmeasurable effect, but we are happy. If our clients are healthy and they don't need us, we are happy. We tried in our clinic to, when we will have a slowdown in the patient flow, we would start following up, and we have a big database. So we start following up with the phone calls, and they say, well, guys, we're fine, we don't need you. Okay, we did our job right. So that's a good sign. And of course, physician heal thyself, your main principle, right? Pay attention to yourself first. You need to be a stronger, more coherent system. Then you can help your client better. By the way, you will get stronger as you heal with your client's healing energy. They will give it back to you. So you will get stronger and more coherent as you go. So that's basically it, guys. And yeah, a little bit behind, but that's it for today.